Hello, Facebook family. How are you guys doing tonight? I'm checking in for our first episode of Dr. Sumner's Summit to Wellness. As promised, we're here at 9 p.m. on Thursday evening to check in and chat about a topic that I think is going to be interesting to many of you. Thanks so much for coming in. Hi, Catherine. Thanks for checking in. Wanted to chat to you tonight about Doc. Why am I so tired? That's going to be the topic for tonight. Hi, Teresa. Thanks for checking in. Hey, Shireen. Thanks for checking in. Hey, Carl. Thanks so much for tuning in. So here's the thing. I decided to start this Facebook Live series because I'm a family medicine physician. I'm a board-certified family medicine physician. I have a strong passion for making sure our communities are well, to make sure that everyone has decent health literacy. What does that mean? Basically, that you have an understanding of what's going on with your body, your health. A lot of times, unfortunately, there's so many of us that are a little bit not as clued in as we should be about what's going on, whether you have high blood pressure or you're just tired, like we're going to talk about, or something else. So that's our goal, is to improve your understanding of your own health so that you can be well, and then hopefully educate your communities to be well. So our subject for tonight is, Doc, why am I so tired? So what we're going to talk about is, what is fatigue? And then we're going to talk about the practical reasons you might be fatigued, the physical reasons, and then some of the mental reasons why you could be fatigued. So we've all been there at some point, right? Many of us are even there right now. I know I'm a little tired. We just had a struggle putting the kids to bed, but we made it. And we wake up tired, and then we go to bed tired, and then we even still wake up tired. So what is going on with that? Do me a favor. If you feel tired right now, or that's a common issue for you, show me a waved hand here in the comment section. Let's see how many of you have experienced that feeling. Let me know. You can't even sometimes fall asleep because you feel so tired. That happens to a lot of people. So we're going to talk about that. Yes, Cal, you've dealt with it. Thanks for tuning in, by the way. It's such a common issue. So let's talk about what fatigue is. Yes, exactly. There's so many of you who feel tired. I know the feeling. Believe you me. And we go through it for so many different reasons. Yes. So fatigue, what is that? It means that you have a physical and a mental state of being extremely tired. Like basically the feeling that you have if you have the flu, or after you got a few nights where you didn't sleep, you feel that tired, but you don't have that issue. You're not dealing with the flu, or you've gotten what you think is a good night's sleep, but you're still tired. That's the medical term for what we mean by fatigue. And interestingly enough, there are a lot of ways that you can manifest fatigue. Sometimes that could be body aches. That could actually mean that you're tired. You could have a lack of motivation. You can feel drowsy during the day. Actually, believe it or not, if you have belly pains, constipation, diarrhea, those are sometimes manifestations that you're fatigued. If you have headaches or difficulty concentrating, or you're really moody, that also could be an indication that you're fatigued, that you're experiencing fatigue. So when you have a long-term physical exhaustion, that can often lead to a mental fatigue, or you can have a mental tiredness or fatigue, and that can lead to physical fatigue. So the both are very much intertwined. And there's a difference, though, between sleepiness, which is, kind of short term, and that can be fixed by you just getting more sleep, or fatigue, which is more of that long-term feeling of, I'm tired. So when you have fatigue, though, that is you have an underlying cause for that. So that's what we're going to talk about. So let's first start with the practical reasons why you might feel fatigue. So do me a favor. Let me know what you think. What is the number one cause of fatigue? What do you think is the number one cause of fatigue? Type it in there. Do me a favor. Make a guess. Come on. You can do it. Any guesses? What is the number one cause of fatigue? All right, well, I'll help. Yes, kids. Jared said kids. Yes, that could definitely be a huge reason. Stress, yes, that is also a very common cause of fatigue. Not eating healthy, your diet, your nutrition, that definitely plays a big role in fatigue. You are all correct. Those are work, oh gosh, yes, that could definitely make you tired. Being overweight, yes, you're correct on that. Thanks so much for all the input. All of those are very strong reasons. Poor diet, your nutrition. The number one cause, though, I know that this is kind of tricksy of me to say, but the number one cause is lack of sleep. Yeah, I know that was kind of obvious, but a lot of us don't think about that. You need to sleep. That's number one. That's the practical reason. Lack of sleep is the number one cause. And believe it or not, according to the CDC, 1 in 3 Americans, they don't get enough sleep. How many hours of sleep do you think you need a night? I think we learned this probably sometime in 3rd grade, but we clearly never paid attention because most of us, or 33% of us, are not getting enough sleep. Yes, that was a little too obvious. Sorry, it was a little tricky of me, but you know. So you need at least 7 to 8, yes, 7 to 8 hours of sleep per night for your body to thrive and revive itself for the next day. So if you're not getting enough, at least this 7 to 8 hours of sleep, then that could clearly be one of those practical reasons why you're fatigued. So when you don't sleep enough, that can lead, in some cases, it's associated with diabetes, high blood pressure, depression. So definitely make sure you're getting at least 7 to 8 hours of sleep. And interestingly, we've got this hormone, which you may have heard of before, that our body makes. One of the glands up here, your pineal gland in your brain, makes melatonin. That is your sleep hormone. It helps to regulate your biological clock. It helps you realize, oh, okay, the sun is setting. It's time for me to head to bed. The sun's up. Okay, time to wake up. Sometimes you may not produce enough melatonin, or you're ignoring your own surge of melatonin, and that can cause you to not get the right kind of sleep. So you actually have a peak of melatonin around 14 to 16 hours after you wake up. So say you wake up around 7 o'clock or so, then typically around 9, 10 o'clock is when your melatonin, that sleep hormone, starts to rise. So if you're not taking advantage of your melatonin rising, then it's very common that you may not get the right kind of adequate sleep. And what I'm talking about right now is something that in the medical world we like to call sleep hygiene. Have any of you heard of that term before? Comment below and let me know. Sleep hygiene. It's a very interesting term. Basically, it means it's the rituals, the norms, the behaviors that are surrounding your sleep. So if you've got good sleep hygiene, you get higher quality sleep and you get more restful sleep. But if you've got bad sleep hygiene, then you get pretty awful, kind of stinky, useless sleep. So it's important to practice good sleep hygiene, and going to bed on time is one of those important things. Another part of good sleep hygiene, which we often forget about, but it's great, a lot of you commented on it, is your nutrition. If your nutrition is poor, then that can affect your sleep significantly. So if you're taking in too much caffeine, too much alcohol, or sometimes any, especially close to bedtime, like within a couple hours of bed, that will definitely throw off your sleep cycle, your ability to get restful sleep. If you're dehydrated, you're not drinking enough water, that's very important. I like to tell my patients, if your pee is not as clear as the toilet water, then you probably aren't drinking enough. It should at least be a pale yellow. So water intake is very important when it comes to your sleep. In addition to that, processed foods, junk foods, they really alter a lot of what's going on with you internally, chemically. A lot of the sugars that are in those processed foods make a big difference with your sleep. So definitely trying to eliminate that. Hi, Dr. Camille. Thanks so much for checking in. All of that is really important. Try to get rid of as many processed foods as you can, because that does affect your sleep, especially the sugar intake. That will put a lot of stress on your thyroid gland and your adrenal glands, and those glands are very important when it comes to getting good quality sleep. Guess what? There are some foods, though, that are helpful in promoting good sleep. They increase what's called your tryptophan levels, and tryptophan will allow you to make more serotonin, which is the feel-good hormone, and also more melatonin, which we talked about is the biological clock sleep hormone. Those foods include cherries, almonds, pineapples, oranges, other nuts, tomatoes. All of those foods actually help you sleep. So you might want to think about that in addition to the warm milk before bed, like Mom told us a long time ago. Try increasing your intake of some of those foods. As long as it's not a problem for you to do that, it may assist with your sleep. Another practical thing that could alter your issues with sleeping effectively is lack of exercise. Now, we know that's kind of like, yeah, we hear that all the time. What does that mean? Basically, if you're not exercising regularly, it could lead to deconditioning, which means that your body, your muscles, your cells, they are not able to do their job. You can't metabolize things the way that you should, break down things, make oxygen, things that help to revive you and make you feel better. But keep in mind, it's very common. If you exercise within like 2 to 3 hours of going to bed, you can kind of get too energized and it could throw off your sleep cycle. So it's best to try to put your exercise closer towards the beginning of the day, but I know not every schedule can accommodate that, but definitely keep that in mind. So we're talking about good sleep hygiene. We talked about you gotta try to go to bed. So lack of sleep's gonna mess with your sleep and ability to feel energized and to cause you to have some fatigue. Poor nutrition, lack of exercise, and also environmental pollutants. So we don't think about this. The list is tremendous, but let's at least start with the radio frequency that we get from our cell phones, our laptops. Those things being in your bed, close to you, when you're trying to sleep, the Wi-Fi, all of that, believe it or not, is interfering with your sleep cycle. It's causing some imbalances that could definitely interfere with your ability to get deep sleep. So if you can, unless in the event of emergency, you might want to keep your cell phone out of the room, tucked under the bed, keep the lights dim, things of that nature, because those kind of pollutants can affect your sleep. We learned back in med school time, and I'm sure you might have heard your doctor maybe say this to you before, but really a big part of sleep hygiene, the bedroom should only be for sleep and sex. That's it. 2 things, sleep and sex. Anything more is going to promote poor sleep hygiene. So if you've got your phone, your iPad, anything like that, and your computer in your room, a TV in your room, that can actually alter your sleep cycle and ability to get effective sleep. Interestingly, you might hear this a lot, but maybe it's possible some of us might not know why, not to use your phone in the bed or while you're sleeping, watch TV right before bed. Why that is because your iPad, your computers, your phones, your TV, they emit what's called blue wavelength light. That's a special kind of light that your brain will actually perceive. It's one of the strongest wavelengths of light that your brain perceives as sunlight. So that means when you're binge watching Orange is the New Black or Grey's Anatomy or whatever in your bed, your body is thinking that it's daytime. So you're watching something on TV at 10 at night, and then you're trying to fall asleep after you're done, and your body's like, whoa, no, I can't. Isn't it like 7 in the morning? What are you trying to do? So it's really important. All of that blue light that you're exposing your body to when you're trying to adjust your body to get into the wave of sleep time, it's important to try your best to minimize that exposure if you can. I mean, for any of you who have kids, I'm sure you've heard that before, but we just forget, like as adults, it's still very important to avoid that. Even just a part of good sleep hygiene, that whole idea of start with, really, start to wind down, basically. Start from way up here and then wind yourself down to get to sleep. So that means like a good temperature in your room. So personally, sometimes I feel like this is kind of cold, but the studies show that between like low to mid 60s is the temperature you should keep your room, your bedroom, to fall asleep and help your body thermoregulate and keep comfortable throughout sleep time. Also, keeping the room dark, that's important. Keeping the room quiet. Some people love white noise, that works too, but a loud room, that is going to be difficult to promote good sleep. And of course, being in a comfortable environment. Interestingly too, there was a study that said that people who binge watch, 1 in 3 people who binge watch have really poor sleep. So I think that means something. I mean, if you're binge watching till 4 in the morning, of course you're not going to sleep very well. But, everyone's different. I would suggest, though, again, keep this in mind. Bedroom only for sleep and sex. Anything else, take the TV out your room, please. If you've got a TV in your room, take it out your room. It will make a major difference. So those are the practical reasons. We talked about sleep hygiene, making sure that you go to bed in time, you exercise, eat well, and that you are getting rid of the pollutants and all the things that could distract you from good sleep. But now let's chat about all the physical reasons why you could be tired. So at this point, say you're going to bed on time. You go to bed, you're practicing all the good sleep hygiene, but you still are tired. You wake up tired. You go to bed tired. You're still tired. What is going on? At this point, I think it's best you need to talk to your doctor. So I might not be your doctor, but you need to talk to your doctor. So I will, though, suggest to you some reasons that you might want to bring up to your doctor if any of these ring a bell to you. So the number one physical cause of feeling fatigue or tired, anyone have a guess? Type it in, comment below, let me know what you think is the number one physical reason, like diagnosis, medical condition that causes people to feel fatigued. What do you think? Do 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 do. Okay, nobody. Anybody? Diabetes. Kala, that's a good guess. It is definitely a common cause of people feeling fatigue. It's not the number one cause, but it's common. Sleep apnea, very good. Stress, great. Thank you, Latrell. Thank you, Abby. Those are important causes of feeling fatigue. The number one cause, physical cause, and stress is actually mental. I guess we'll put it in that category, so we'll talk about that a little later. But the number one physical cause, thyroid, is anemia. A low blood count is the number one cause of feeling fatigued or tired. 1 in 3 Americans actually have, 1 in 3, that's wrong. What I meant to say is more than 3 million Americans actually have anemia. So that's a lot of people. And the number one symptom of anemia in most cases is fatigue. And that may actually be all you feel. That's the only symptom you have. You're just tired and you can't explain it. And that's because you might be anemic. Your blood count might be low. You might notice that you're losing blood in some way, or you might not. And it's especially most common in women of childbearing age. So, because you're having menstrual cycles, you're losing blood during that time. And so it's common for you to be anemic. So that's the number one cause. Another very common cause is a thyroid disorder. When your thyroid gland, which is the gland here, helps to regulate your metabolism, if that's low, if you have hypothyroidism, that is a very common cause of fatigue. And anemia, hypothyroidism, those are super easy to diagnose. I mean, just go to your doctor, say you're tired. Bet you that's one of the first tests they'll do is check your thyroid and check your blood count. So it's really easy. And then and then you can treat it. Other causes, someone mentioned it earlier, diabetes. So high blood sugar, low blood sugar, that can cause you to feel fatigued. Lung disease, a biggie, is sleep apnea. Someone mentioned this earlier. So actually, 1 in 3 adults, in the US, they actually snore. So we've got a good amount of people on the call right now. 1 in 3 of you probably are snorers. I don't know if 1 in 3 of you will admit that you snore, and that's half the problem why sleep apnea is poorly diagnosed. We often can't diagnose it because a lot of people either don't know that they're snorers or they don't want to admit that they're snorers. But if you snore and you lose a moment of breathing during your sleep, that is sleep apnea. If there's a moment when you do not breathe, that's sleep apnea. And when that happens, if your circulation, your breathing is cut off, you lose oxygen to different places of your body, different organs, and that could be severe. So there are people who are diagnosed with sleep apnea, they don't wear their treatment, which we call a CPAP, and it's much more serious than you might think. Your heart does not get oxygen for a period of time because sleep apnea occurs, and you could have a heart attack. Did you hear me? You could have a heart attack. You could die in your sleep because you snore. So don't play. If your partner is telling you that, baby, what was wrong with you? You had a moment there. You didn't catch your breath. That is not something to ignore. Please bring it up to your doctor. Sleep apnea is real. And a lot of times that is, again, fatigue might be the only manifestation of you having sleep apnea. Big risk factors for that are if you're obese, if you're bigger, if you've got a thicker neck, if you are, if you're a smoker. There are a lot of risk factors, but especially if you are a snorer and you're fatigued, it's something worth bringing up to your doctor. Other lung diseases are pneumonia, asthma, COPD. Those could all cause fatigue. If you're not getting, again, enough oxygen, it's the biggest form of nutrition for our bodies. So if you're not getting that, then it can cause some fatigue. Also, heart disease. That is a biggie too. A lot of people, you will often not, especially women and diabetics, you will often not get the crushing, oh my God, chest pain that makes you know you're having a heart attack. It is not like in the movies. A lot of times it could be something as simple as you've been walking your dog for years and years, never had a problem. And now all of a sudden you're winded when you're walking your dog. If you do something that you usually do without a hiccup and now all of a sudden you feel pretty tired afterwards, that sometimes could be a sign of heart disease. So it's worth checking out. Heart disease, valvular heart disease, heart failure, congestive heart failure, those are all potential reasons that you could be fatigued. Give me a sec. Sorry, guys. Water break. Another reason that you could be fatigued, infection. That's maybe a little obvious. I don't know, but some people even have long-standing infections that they may be unaware of. So mono, That's the kissing disease from like high school, but there are adults that we diagnose with mono, but especially if you're in high school, college age, and you're feeling this ongoing, like, you're just tired all the time. You can't pinpoint. It could be an infection like mono, HIV, flu, hepatitis, and especially in the elderly, but it can happen with anyone. UTIs, bladder infections. Sometimes the only manifestation of that could be fatigue. So that's important to think about. Being pregnant, that can definitely drain you. That can cause you to feel fatigue. And even postpartum, when you're, tired after having a baby, that can cause you to feel fatigue. So that's important too. Also, one that we often don't think about is acid reflux, GERD, or inflammatory bowel disease. So things that affect your colon, it can lead to you becoming deficient in certain nutrients. That can eventually lead to fatigue as well. So even something as simple as heartburn, if that's not treated, that could cause you to become fatigued. Any kind of chronic pain condition like fibromyalgia, lupus, rheumatoid arthritis, especially things that are keeping you up at night, that can also cause you to have fatigue because you're having pain through the night. Kidney disease, liver disease, a weakened immune system like from cancer or HIV or something of that sort, that can cause fatigue as well. One that we don't often think about, but it is important, is your dental hygiene. If you've got root canals or this chronic dental infection that you're not addressing, that can also cause you to feel quite tired, fatigue, because your body is constantly fighting off what's going on. Vitamin deficiencies are a biggie too. The most common tends to be vitamin B12. About 10 to 15% of aging adults deal with vitamin B12 deficiency, and that can cause significant fatigue, as well as vitamin D deficiency, which is also very common, especially in African Americans. We tend to not be able to take in a lot of vitamin D from the sun because of the melanin pigment. Another one is magnesium. If you're low in magnesium, it can cause you to feel depressed, but also very tired. So those again are things that all you gotta do is talk to your doctor. They check it with a blood test, you get it figured out, the end, hopefully. And also hormone deficiencies can cause some fatigue, like estrogen, if you're low in that, testosterone, human growth hormone, thyroid hormone we talked about. Those can all cause you to feel quite tired. So the best part about everything that I shared with regards to physical causes of fatigue is that most of them can be pretty easily diagnosed. And once they're diagnosed and treated, then in most cases, your fatigue will improve. Yay! So that's great news. So those are the physical causes of fatigue. Has that been helpful so far? Let me know, comment below if that's been helpful information for you. Again, I'm sorry if I'm not your doctor, but I'm sure you're in great hands. So if any of this rings a bell with you, talk to your doctor because these could be physical reasons why you might be tired. Let's now go to some mental causes of fatigue because that's just as important. Number one, a common cause, if you are dealing with the loss of a loved one, you're dealing with grief or bereavement, that can cause you to feel quite tired, fatigued. And that's normal. It's very, very normal. But if this goes on for months and months and months, and it's probably time you want to have a chat with your doctor about it. If you have an eating disorder, that is also a rather common cause of fatigue because it can lead to a lot of nutritional deficiencies that will lead you to feel tired because your body is not getting all of the fuel that it needs. And let me just jump back to nutrition real quick. The reason why good nutrition is so important when it comes to feeling energetic and to not battle with fatigue is because literally your food is your fuel. Your food is your fuel. So I like to say I'm a Rolls Royce. No offense to anyone who drives a Ford. I grew up in a Ford, but a Rolls Royce is not a Ford. So I put premium gas in a Rolls Royce. You might not need to put premium gas to fuel a Ford, but I need premium fuel to fuel my body, to do what it needs to do to run effectively. So if you are putting regular gas in your Rolls Royce body, no wonder you can't run like a Rolls Royce. So food is your fuel. Nutrition is extremely important. So that's why we stress on that as much as we can. But yes, eating disorders, they can lead to some of these nutritional deficiencies and cause you to feel fatigue. Another one that's that is definitely an issue, alcohol abuse, drug abuse, those can lead to you feeling fatigue. And anxiety and depression, those are definitely very common causes of fatigue. And a lot of times, especially depression, your only manifestation, again, that you may notice is you're just tired and you can't pick up. You just can't pick up. That could be a manifestation of depression. So talk with someone about that, your doctor. Seasonal affective disorder. That is a very common cause of fatigue now that it's getting colder, the days are shorter. Think about this, keep it in mind. I know I had some semblance of it when I was in college and those days were longer. I would just hate taking exams, etc., because the weather, the season, it affected me. So that can cause some fatigue as well. And stress. Yes. Many of you have said it. Stress is a major, biggie cause of fatigue. When you are stressed, you produce more of what's called cortisol, which is your stress hormone. Cortisol, to a certain extent, is actually pretty good to have around. It helps keep you going. It helps make sure that you've got enough energy to make it through the day. It helps with that fight or flight response. But when it's nighttime, you really don't need none of that. But if you're stressed, your cortisol levels can be through the roof. And that often will disrupt your sleep cycle tremendously. So working on a way to combat your stress is major. When you're stressed, you might have this feeling of like being wired and tired at the same time. So you're like, you're kind of all over the place. You just, you feel like you just can't calm down, but then you're tired at the same time. Like, what is that? That's stress. So if you have that feeling, talk to somebody, talk to your doctor, talk to your therapist. Think of work on ways to manage that. Yoga, meditation, prayer. There are so many ways to help manage your stress, which maybe we'll talk about at another time. But stress is a major cause of fatigue. 7 out of 10 U.S. adults deal with stress, and 70% of those adults can't sleep. So that's a lot of people. So it's something really to work on. And then you can get into this vicious cycle of stress, and then you can't sleep, and then because you can't sleep, then you're more stressed, and it's just awful. So let's work on that. If you feel that that's something that you might struggle with, please talk to someone who can be of help for you. So let's recap a little bit. We talked about what is fatigue. That's when you've got a mental and a physical state of feeling super tired. We talked about a few reasons why you could be fatigued. Practical reasons like sleep hygiene, making sure you go to bed on time, that you're sleeping for seven, is that, I hope that's the right way. I don't know if I'm mirroring or not. 7 to 8 hours of sleep every night. That you're going to bed while your melatonin levels are rising. You're in a dark cool room, that your bedroom is only used for sleep and sex. Those are all very important pieces of sleep hygiene. And then we talked about some of the physical reasons. Anemia, number one, low thyroid, sleep apnea, heart disease, all those are really important. One thing that I failed to mention, and I apologize, are medications. That's another biggie when it comes to causing fatigue. We love medicines in some cases. It helps a lot with a lot of conditions, but they're not benign. They can cause side effects. But some biggies, sorry to jump back a little bit, but wanted you to know, high blood pressure medicines, antidepressants, cholesterol medicines, allergy medicines, steroids, birth control pills, hormonal medicines, those are often common causes. So if you've ruled out mostly everything else, but you're taking medication, that could be a cause. Chat with your doctor about that. So we talked about a lot of physical reasons that you could be tired. And then we talked about mental reasons. The biggie is often stress. So we've got to figure out ways to manage your stress. So I hope that was helpful for you guys. Was it helpful? Let me know. Comment. I'm going to give you guys just a couple minutes if you'd like to hang out. And if you have any questions, type them below. I'll try to answer as many as I can in the next few minutes. I'll scroll through a little bit. And also, let me know if you have any topic suggestions for the next talk. But it's really been a lot of fun hanging out with you guys, and I hope that this was helpful information. So let's see if there are any questions that that I can try my best to answer. Let's see here. One question that I see from Miss Marsh, thanks for asking, is alkaline diet enough to fuel for energy? So I'll be frank, I'm not a nutritionist. I'm not going to pose to be a nutritionist. Maybe at some point we can bring on someone who's a better expert at nutrition than I am. I am familiar with the alkaline diet to some extent though. And from what I've read and seen, the alkaline diet is enough fuel in most cases to give you the energy that you need. But I would suggest that if you're taking any kind of special diet, you definitely want to keep your doctor informed so they are aware of any nutritional deficiencies, protein deficiencies that they need to keep track of on your end. And if there are no other questions, I just want to thank you all again so much for tuning in. It's really been awesome hanging out with you all. Spread the word. I'll be sure to update you about the next time we'll be checking in. And make sure you go to bed. Go to bed. Thanks for checking in on Dr. Sumner's Summit to Wellness. You guys have a great night.